everyone for coming and attending this webinar. My name is John Tam. I'm the facilitator for this webinar. So I'm the system administrator for Aesthetics and Skin Institute. So I look after all the online courses and workshops. So today our topic of discussion is how to treat skin conditions with chemical peels. So we've compiled a bunch of questions that we thought was most commonly asked, and we've also got some of your questions that you put through when you registered. And we have Jess and Jenny who will be interviewed today. And Jenny is actually the part of the team, and she's been interviewing quite a few people, and we'll be posting in the upcoming social media. So I'm just going to, what's going on there? There's been some people walking in the background. Hope everything's okay. And if we can just have Jess, Jenny, how's the audio? Can you guys say hi? Make sure audio is working. Yep, everything's working. Excellent. So just a bit of housekeeping before we begin. Thank you for joining, Donna. In terms of housekeeping, we've muted everyone, but what we'd like everyone to do is type up their questions in a chat. So if you've never used Zoom before, chat is actually on the bottom of the screen, and you can actually have your questions there, and we'll try and answer it depending on time. So over to you, Jenny. Please introduce our guest.
Hi, so we're here today with our skin therapist educator, Jessica Zarnay. So thank you for taking your time out of your busy schedule to be with us. So today we'll be interviewing Jessica and discussing the topic treating skin conditions with chemical peels. Jessica Zarnay, she's been in the industry for over 12 years and has an incredible energy and passion for the skin. She takes pride in providing a high level of customer service, and she's dedicated in providing her clients with optimal results. With years of experience within the industry, she's enthusiastic and proud to impart her skill set and knowledge onto others, and we're very proud to have her as part of our team. So thank you once again for being here with us, Jessica. Thank you. So first of all, could you just give us a brief introduction to chemical peels?
Sure. So introducing chemical peels. Cosmetic peels are also known as chemical exfoliation, and they treat quite a wide range of skin conditions. The acid in a chemical peel all perform the same thing by breaking down the dead skin cells and dissolving the bonds also that hold the dead skin cells in the layers. So the end result, you're looking at a smoother, brighter, more fresh, glowing skin.
Perfect. So what forms do chemical peels come in?
So chemical peeling agents come in either liquid, gels, also powders or creams. This will determine on how much product you will need and also how long it requires for the peel to sit on the skin, and also the layers, how many layers you would use as well, applying on the skin for optimal results. Example, if you're using a liquid solution, the absorption of that is quite quicker into the skin, so it requires less of the actual product that you'll be using.
Great. So what are the different types of chemical peels?
So the different types of chemical peels, you're looking at AHAs, which are alpha hydroxy acids. These are glycolic acids, lactic acids, and mandelic acids. And also the BHA, which is beta hydroxy acid, which comes in a salicylic acid form. Also, there is TCA, which is a deeper, more dermal peel, and this is great for scarring. Also, you have combination peels, which is a mixture of your AHAs and your BHAs together, and these are the Miami and the Jesna peels.
Perfect. So could you tell us a little bit about the AHA peels and which skin conditions?
Sure. So as mentioned, the AHA peels, the glycolic and the lactic and the mandelic, these can be quite superficial to light superficial, also going down a little bit deeper to medium depth of the skin. And with glycolic, it is quite a small molecule, so it penetrates into the skin quite quickly. So you tend to get a little bit of that irritation, that bitiness on the skin. As opposed to lactic acid, it's a larger molecule, and so the absorption into the skin is slower. It also helps to draw in a lot of moisture, so it acts like a humectant. So it will make the skin very hydrated, very moist. Yeah.
Great. So what are some contraindications for cosmetic peels, and who shouldn't have them?
So contraindications you're looking at if they're allergic to something. So aspirin is a big one, as well as any salicylic allergies, Roaccutane, if the client also is pregnant or breastfeeding. Also, using any medications that are photosensitizing can be a contraindication, and keloid scarring or history of it, as well as unrealistic expectations. So you always want to make sure that you sit down with your client and you go through with actually what they want to achieve with their results.
Yeah, so which skin conditions can chemical peels target?
So with chemical peels, the specific treatments for them that target specific skin concerns is aging, hyperpigmentation, as well as enlarged pores, congestion, acne, and also rosacea.
And how would you usually prepare for a treatment?
So you would always sit down with your client and go through a thorough medical consultation form with them, followed by a skin analysis for their skin and see what peel will be suitable for their skin type, as well as conducting a test patch that you would apply and wait 48 hours after. And if it's a-okay and there's no reaction, you would go ahead and you would continue to have their first treatment. And you would also go through the consent form with them to ensure that they understand all the risks as well involved, and what to also experience with their results, and also their downtime that they can be having through their recovery process. And also be sure to take your before and after photos.
Yeah, that's very important. So which peels would you consider the safest, and are they safe for all skin types?
So yes, they are. So all skin types are eligible to have chemical peels, but you have to always consider the depth of the peel too, to see where the skin's really at and what skin condition you want to treat. For example, you would have to go much deeper with a TCA peel if you do want to treat acne scarring, as opposed to if you want to treat superficial pigmentation, you can definitely go with a superficial lactic peel, for example.
Great. So which measures would you usually take to ensure that the peel is safe for your patient?
So you would always make sure that the skin is really well prepped. And we recommend 2 weeks before having a peel. So using AHA on the skin is ideal, because this will remove the dead skin cell buildup from the stratum corneum, so the peel can penetrate a lot better into the skin and give the client optimal results.
Great. So can all skin types have peels?
Yes, all skin types can have peels, but you have to keep in mind that when you're treating the client, the skin type can sometimes be a little bit dehydrated. So skin types, for example, that are a bit more drier need to rebuild, strengthen, condition their skin a lot more first. So you would go in, say, with a lactic acid to really help increase the moisture in their skin. And if you're wanting to treat a skin type, say, that's really congested and breaking out, then you would go for a BHA, which is a salicylic acid form. And this peel is really great because it penetrates into the skin and helps to break down any excess oil flow and cleans out clogged pores that contain that buildup of bacteria and congestion.
Great. So after having a chemical peel treatment, what aftercare would you recommend to your client?
So we would advise our clients not to use any active ingredients for a few days and let their skin really heal well. We do recommend gentle cleansers, and also sunblock is really, really important, because their skin is quite still fresh and new. So it's really important to be using your SPF sunblock. And also we do encourage for darker skin types to be using a telomerase inhibitor, just to avoid any pigmentation that can occur in the skin as well post-peel.
Perfect. And how would you usually keep track of your patient's results?
So it's really, really important that you document after every treatment how the skin was feeling and looking, and if this client was in any, for example, discomfort. We normally say for a scale of 1 to 10, how does it feel? Everything like that should be documented, as well as your before and after photos. Definitely, that's very important.
Great. So thank you so much for answering these questions for us, Jess. We also do have a few questions from our viewers, if you don't mind answering them.
Yeah, absolutely.
Perfect. So our first question is from Dr. Sohaib. Sorry if I haven't pronounced that correctly. The question is, what is the best chemical peels for acne scarring?
So acne scarring, it starts a little bit more deeper in the skin. So you need a deep depth peel. TCA, for example, would be ideal to use because you really want to help to remodel that dermal layer in the skin and smooth out those scarrings. But you also have to keep in mind the different types of scarrings that they have and the depth of the scars. So definitely you would tailor suit a program for them and a course of peels for the optimal results thereafter.
Perfect. And we also have a question from Anne, who would like to know about how to treat melasma with chemical peels.
So melasma is a tricky skin condition. It's a medical condition and it's hormonal. So with melasma, you can definitely treat it with chemical peels, but you do have to take into consideration that it's an ongoing treatment they'll need to have. Because with melasma, any type of heat, for example, so in summertime, it can get a lot worse. So maintenance is definitely the key. But if you're looking at melasma, great peels for that. I would recommend lactic acid peels, as well as going a little bit deeper if the melasma is a little bit more stubborn as well. So you would go in with the TCA peel.
Great. And we also have another question from Rebecca. So she would like some advice for training in chemical peels.
So training is really important because you as a therapists want to be very also experienced and very confident in your treatment, so you deliver the best results that you can for your client. So definitely hands-on training is really, really important, as well as educating yourself and doing and keeping up education programs and training, and definitely in-house programs are very, very important.
Yeah, great. So thanks so much for answering these questions for us today. We might move on to John, who might let us know if we've got any more questions from our viewers.
Thank you, Jenny and Jess. Yeah, so there's been some questions because some people have just joined us. I'm not sure if we touched on this, but one of the questions we've got here is, how can I deal with burns after chemical peels?
So I would suggest the burn from the chemical peel is post-inflammatory pigmentation. So for them, doing a light treatment to help the recovery process and help to regulate the melanocytes in their skin, LED treatments are also very effective. A course of them I would recommend, as well as using a pigment blocker, so a tyrosine inhibitor, to help suppress any increased pigment in the skin from the trauma, and a consistent skincare routine as well for them to be using at home with active ingredients such as vitamin A also.
Okay, we've also got, which types of peels are best for pigmentations?
So it really determines where the pigmentation is in the skin. So if it's in the superficial layer of the skin, so within the epidermis, I would say lactic peels, your AHAs, like your mandelic and your glycolic peels work very, very well. But if the pigment sits a little bit deeper into the skin, so medium depth peels are very good, like your TCA and your Jessica peels, because they will be very effective to penetrate deeper into the skin, break down that stubborn pigmentation that you want, and start breaking it through the surface of the skin.
Yeah, we've got a question from Sally here. How can we treat rosacea with chemical peels?
Yes, you can treat rosacea with chemical peels. So rosacea is a medical condition and it can flare up from time to time, but medical peels that are superficial and designed to really strengthen, condition and hydrate the skin are great to maintain rosacea because this is an ongoing skin condition that definitely needs maintenance, but you can have flare-ups too, for example, in wintertime with the harsh wind as well, and the low humidity and the heater, you may find that your clients do sometimes have a little bit of accelerated rosacea through the cheek area, but maintaining the skin, strengthening and conditioning the skin will really help control that.
Okay, message from Brooke. What is a tyrosine inhibitor to buy, please?
So a tyrosine inhibitor is like a pigment blocker. So those, it's a specific ingredients to help basically block that pigment and trap it into the skin. So sometimes when you do a peel, for example, and it's a little bit too much of a strong peel for the skin to handle, or a darker skin type, so a tyrosine inhibitor will be good to really block that pigment down because the pigment can shoot up to the surface because it wants to protect all the skin cells that are in trauma. So pigment blockers also come in vitamin C, but pigment blockers normally you would have by your cosmeceutical skincare that will be very effective.
Okay. So what do I do if my client has post-inflammatory hyperpigmentation after peels?
Sorry, you were breaking up a little bit.
Sorry. What do I do if my client has post-inflammatory hyperpigmentation after peels?
So PIH, post-inflammatory hyperpigmentation after peels, so it can occur relatively darker skin types. So what I would recommend is, like I said, using a tyrosine inhibitor, pigment blocker to help break down accelerated pigmentation in the skin, and also an AHA. So an AHA you can use for them say twice a week, and that will break down the bonds that hold the pigmentation through the dead skin when it's actually moving through the surface of the skin.
Okay, just back to Brooke's question. She was actually asking about brand. Can you recommend any brand in terms of
in pigment blockers?
no, in the
Skin,
tyrosine inhibitors? Can you recommend any brands for tyrosine
so the
inhibitors?
tyrosine inhibitors, so for example, cosmeceutical skincare, I would recommend from SkinCeuticals to Aspect Doctor to some cosmetics skincare brands out there that are really great.
Okay, I hope that answers your question, Brooke. What type of pills for anti-aging, fine lines and wrinkles?
So it really depends on the skin in terms of where the skin's at with age and how damaged the skin is with sun damage that can obviously cause, you know, your fine lines and wrinkles. So when you're looking at more of a younger skin, the superficial peels are ideal to be treating, but when the skin is more aged, going in deeper to really help undo and help to create that result in your collagen stimulating and your fibroblast stimulating in your skin will all help your remodeling of your dermal layer in resulting in your skin being smoother, the texture improving as well on the surface and diminishing your fine lines and wrinkles.
So do we need to use something stronger than peels?
So sometimes you would need to go, depending on where the skin's at, a little bit more stronger in depth. So medical lasers are definitely ideal, and also you'll be looking at other treatments down the track, for example, injectables like your Botox.
What are the best or most popular peel brands in Australia?
Most popular peel brands in Australia, when you're looking at cosmeceutical skincare, I would recommend SkinCeuticals. They are fantastic because they're very active. So the more active your ingredients is, the more it penetrates into the skin and creates change into the skin. And that's what you really want to get that result with your skin looking more healthier, glowing, and also specifically addressing skin concerns, for example, pigmentation, dull skin, if you're suffering from rosacea or even acne.
Okay, it's got one more question. Should we just try and think if there's any more questions? If you guys want to type up your questions in the chat, please feel free because we've got some spare time. We've got about 5-10 minutes. So if you haven't used chat before, just move your mouse to the middle of the screen at the bottom where it says chat, and we're happy to answering your questions. So I've just got some other questions here relating to, let's see, do we need to ask for consent before performing peels? And what do we discuss?
Yes, absolutely. Consent is very important because there are always no guarantees. When you do a series of peels, you would ask for the consent before you go ahead and you have your first treatment. So consent always will require a signature from the client, and it's very important to be using in any skincare clinic that you're performing medical grade and chemical peels.
Okay. Doesn't look like there's any further questions from anyone. As we mentioned earlier, we recorded this webinar so that you can actually watch it over. Or at any time you can send us an email if you have any questions or inquiries about our online course. Jess, anything final words you'd like to say?
So always think about peels when you're treating clients, that peels can give them a little bit of downtime. So always really educate them on how they will go through their downtime and what they can experience, because you don't want your client to be like, what's going on? I'm not sure. Am I supposed to be going through this? You know, is this normal? Is my skin supposed to be this dry? So just reassuring them always keeps them at ease. And obviously the aftercare is very important for them, and their sunblock, and just having those before and after photos for yourself and them.
Okay, that's fabulous. Thank you very much, Jess, again for your time, and Jenny, and everyone else who joined us today. Just one more point, we don't have any commercial interest of any brands that Jess mentioned earlier, so it's important that you do your own research and look it up yourself. So thank you again, everyone, and I hope to see you on our next webinar. So it looks like it might be about threads. So
I just want to...
sorry, you want to say something? Yes, sorry.
Sorry about that. Just want to conclude as well the webinar. So if you're looking at having chemical peels and you're really wanting to, for example, educate yourself, and you're wanting to find a refresher course, this course that we do offer goes into detail. So you'll be going through the process of understanding how a chemical peel works, the ingredients base behind it, and also it covers all aspects of chemical peels. So definitely doing the course and educating yourself for a refresher or a first time is great. You'll love it. So highly recommend.
Thank you for that, Jess. Okay, Ryan, have a good day. Enjoy the rest of your lunch. Thank you. Take care.
Make sure you visit our website and sign up to our exciting and informative injectable and skin courses and more.